Today on the program, we will be discussing the importance of emergency services. Our guest today is Mr. Obodozie Christian Uche. He is the CEO and Country Director of AfriEmergencies. Mr. Christian, welcome.
Thank you so much, Doris.
And it's nice having you here.
Same here. Happy New Year.
Oh, thank you very much. Now, straight to our discussion, talking about emergency services in Nigeria and closely streamlining it to the FCT. We know that they're very rare. You would hardly see private people or private organizations having ambulance or generally emergency services, because while growing up, for me as a person, I've only known hospitals to provide emergency services. And that has been like a major problem in the healthcare system, because you see people that have emergency situations, but before they're able to get ambulances that would treat them or that would bring them to the hospital, or along the way before they get to the hospital, get first aid, we have lost quite a number of people due to the lack of very slow response to emergency situations. So in context now in our country, what do you think would be the way out in handling emergency services?
Well, the way out in handling emergency services in the country is actually a very vast and big topic. But I think we're talking more on pre-hospital care, which is emergency ambulance service, right? Emergency services are vast. I mean, you have in-hospital and out. Like you said, let's come down to FCT where we are, because in the country as a whole, it is the same thing, it's the same problem. You know, we have consistently had this issue of pre-hospital care. People, a lot of lives have been lost as a result of this. Let me just veer a bit and tell you my personal story, why I actually got into this. By training, I'm a pharmacist, you know. And growing up, we have a hospital in Lagos. I grew up in Lagos. Sometime when I was in second year pharmacy, came down to Lagos for holidays. There was a case in the hospital. Normally, as a pharmacy student, you know, go to see things and all the rest. Doctors take me around. I see. Then one day, someone gave birth in the hospital, and we didn't have in the hospital. They don't have incubator, and it was a preterm birth. And the director is not around, the doctor is not around, and the ambulance, we had an ambulance lying there. And it's my brother owns it, so they call me director's brother, you know. The people were crying and shouting and making noise all over the place. And I came and I was like, what's the problem? They don't say, my brother, there is no ambulance, there's no driver to take them out, and the director has not given instruction, blah, blah, blah. And the woman has a premature birth, and we don't have an incubator. So we tell them, make them carry and go any other place where they fit. Tell them, make them carry and go any other place where they fit, get incubator.
That's supposed to be like a referral.
That's a big job on a poor man who actually does not even know what an incubator is. Telling him, carry him, maybe you have to enter bike or wherever. That's a child of 7, a preterm birth, a child that is premature. Carry and go anywhere where they get incubator. That is a systemic issue. And this happened way back. I said I was just in second year. Do you understand? So I was like, come, madam, come. I carried her. I carried the man and the child, put in the ambulance. I was the driver. I put on the siren. This was in Satellite Town, if you know Lagos. I drove all the way from Satellite Town with the siren, went to Lagos Island Maternity Hospital. We drove, if you know the distance from there to Lagos Island is a long distance. You have to pass through Mile 2 and all the rest. Drove down there, rushed in. He said, no, the incubator. We got back into the ambulance, drove again from there down through Third Mainland Bridge, down to not Lut, Lasut, you understand? And they now ushered us in and rushed us in. As they put the child in the incubator, the man came out. My brother, you don't know what you don't do for me. Thank you very much. This is like how many years? Close to up to 15 or 18 years ago. And till now, I don't know that child. She should be 18 years and above. I've not seen that man before, again, since then. But my pride, my joy in that was that at least a life was saved.
Yeah.
If I didn't take that action that day, I was just a young undergraduate. Obviously, 80% that child would have died. You understand? So this scenario plays out everywhere in a lot of places in the country. It's a system, it's a problem. You understand? Now, coming back to your question, how do we solve the problem at hand? It's actually a multi-system solution, in my view, actually. how do I mean by multi-system solution? There are three tiers of people that I think, in my view, from my experience, that are very much involved in this. You have the institutions, which is the government. They are actually very important to handle this. Then you have the private sector, ambulance service providers, hospitals, and others. Then finally, the one we always ignore, the people themselves are actually very important in emergency care provision because of sensitization and teaching people. A lot of people in our country see healthcare provision as things for nurse, doctor, and all of them. I know they work for hospital. But a mother or anybody who actually knows the basic CPR, knows how to resuscitate, knows how to, you understand, basic emergencies on cardiac arrest, a child that, if your child swallows, say, a bone knife, what are you going to do? They are basic, or a snake bite, what is the first thing to do? There are a lot of procedures that anybody can learn. There's something online the other time, a young boy of, I think, 10 years, the grandpa had a cardiac arrest. 8, 9 years, not 10 years, in America. Because he had been exposed to some of these procedures, CPR, cardiopulmonary resuscitation, he called 911 and kept, trying the little. And that little he was doing was actually impactful. They told him he continued until the ambulance came. This is a 10-year-old child. Do you understand?
Yeah.
It also happened, there was another one on internet. Is it people that were working on electricity or something like that? One had a cardiac arrest or electrocuted. Up there, the other one was doing mouth-to-mouth resuscitation on him, up on the ladder where they were, until they came. That act actually saved. So, what am I saying? The people, we have to actually reorientate us. Everybody, health system is a multi-component issue. It's not just the professionals or the government. The people should also be very much carried along, very much involved. So, these three systems, if effectively stimulated, will actually help to ensure a holistic pre-hospital care or emergency healthcare system.
Well, there have been so many attempts to see how to make emergency system in the country revived and very vibrant, but there have been a number of challenges. Can you run us through some of these challenges?
Well, so many attempts has been made, but I might actually say that these attempts has actually not come to the fore or been carried fully along because of consistent solo input on the government. Do you understand? Mm-hmm. That the government is to do this, the government is to do this. And it has consistently made it to a large extent fail. Because if you do not carry the private sector, and the second and third component I'm talking about, which is private sector and the people along in this, obviously there might be there will be a systemic failure. Now, you said, what are the attempts that have been made? Let's start from the currently, this government, even let's come to FCT, which is where we are actually. Mm-hmm. Some 2-3 weeks ago, we got a call from the Health and Human Services, okay, that they want to have a stakeholders meeting on pre-hospital care, emergency ambulance service. So all companies who are actually offering that, and the Ministry of Health and the FCT are going to come and they are going to have discussion and others. I think, from what they said, the Ministry of Health has actually conceptualized an ambulance provision system that would actually take care, that's now coming together with the private sector, which was not always done before, you understand, and the people to actually effect a more robust healthcare system. According to what we also told, FCT is the nodal point, the first test point for this, but we are still waiting for that. They said they are going to call last time we called, they said the Minister of Health has not developed the dossier. They have not called. So when they do, we are going to call. And it's a very wonderful, I must give it to if it's the Minister of Health or the current FCT Health Secretary or whoever, we don't know. But whomever is piloting this, it's actually, it's awesome. It's life-saving. It's long overdue that something like this should actually come up. That's the current one that we're having now. So it actually means that from the FCT, it's going to spread to other states of the country. if the FCT, which is the test point, the first point, goes and it's going very well, it's going to spread to other parts of the country, and it's going to be, yes, obviously there might be some failures, checks, balances, and so after that it's going to be put in other states of the country, and hopefully make it for a vibrant healthcare system. Then going back, there have been efforts in other governments to actually do something like that. But like I said, it's because it has always been a government thing. And it's because the government thing, people see it as our own. You understand?
Yeah.
And it wasn't really successful. A lot of people in Imo State, it happened. Rochas came out sometime, and during the tenure of Governor Rochas Okorocha, I was watching on TV. They said, now Mama in the village can actually call ambulance will come and pick her. And I say, wow, this is wonderful. Really? I'm actually from Imo State. I said, oh, if my state where I'm from is actually pioneering this, I think I should actually. We went down to Imo State, met lucky enough, the Commissioner of Health, actually a friend whom I know. So had a meeting, talked about, oh, this is wonderful, blah, blah. Okay, what we want to do is training, emergency care training, making sure that people have ACLS, BLS, and PALS, advanced cardiovascular life support training, basic life support training, which is basic, pediatric advanced life support, advanced trauma life support, which is actually do these trainings for people. You want to start up a system. Of course, you should actually take care of the personnel, you understand, that will actually handle this system. We are so, went to most teaching hospital, met the CMD, had a good meeting. They gave us a list of nurses and people who are supposed to be involved in this. We're going to be trained and all the rest. Came from Abuja to Imo. Again, we now went back for another meeting and all the rest. Meanwhile, this is going on in TV, advertising. If Mama call now, ambulance will come, even for the remote part of the village, blah, blah. So what are these for advertising? We are actually trying to ensure that these trainings are done so that these people will actually, because that you are.
So you hadn't even taken off at then?
This is how called. It doesn't even take, we that actually went there to see and are trying to be part of it, knows that it's not even functional yet. Do you understand? Mm-hmm. And the shocking one was when we now had, because if you are a nurse, a doctor, or whoever you are, there is certifications. You have these certifications. Yeah. You have basic life support certification. You have different training centers do it. You understand? There's one from American Heart Association and the rest. So, went. And the CMD said, Mr. Chris, the issue is that the governor said, yes, that they want to do this soon, but that there's no money to do this training for these people, that if we can actually do it for free, that would be good. I said, sir, but how can you start up a system without actually having, it's not just to buy ambulance and drop everywhere, without fully having up a systemic review of the processes involved in setting up this system. And you have money to buy all the ambulances, which is multi-millionaires, and you don't have how many thousands to do training for basic staff who are going to handle it, and you think it's going to succeed? Say, well, I am a consultant. I'm not a politician. They take the decisions. And that was where that fit in there. And you and I knows in Imo State today, that thing
it's
just
not functional.
On the TV.
So I see challenges of majorly now, and that's talking about the government's systemic issues that would pose as challenges to being able to implement some of these things. Well, you started talking about something that I actually want to talk about, equipment and personnel.
Yes.
And so it's not just about having the ambulances, because the moment you say ambulance emergencies, care services, first thing that comes to mind is how many ambulances do we have? Forgetting that not every doctor, not every nurse, not every medical officer or medical personnel is qualified enough to be able to actually tow that line,
Very true. Very true.
But okay, for now, and we're already seeing steps in the right direction that the FCT is going. What can be done for personnel? One, let's make sure that personnel are well trained, and equipment. Does it just end there?
Well, like you said, that is a very vital section, which actually has, a lot of people. But like I said earlier, the FCT is, I think, what they're doing, I'm applauding it, if and if only also they push it and see it to conclusion, which I hope the ES and the people involved will actually do that since they've started it. Personnel is a very important thing. And what do you mean by personnel? The core personnel, actually, in paramedic, in emergency care system, are paramedics. And do we actually have schools for training of paramedics in Nigeria? The only school I'm aware of that does that is University of Benin. You understand? Now, if Uniben is, I don't know if that's, but the one I know as at last year or 2 years is just that Uniben. And if they're the only institution that actually does offer that course as a course in a country of over 200 million people, then you should know that we are seriously short of that. However, that's not to say that we cannot do anything without having paramedics. You understand? Because the trainings, there are also trainings that, like I told you, there are certifications that people can have. I know that Nigeria Nursing and Midwifery Council also ensure they do basic trainings on BLS, but not certified training. They do training on CPR and all the rest for nurses. But there are centers in the country. I know of American Heart Association have centers in the country that actually do these trainings for doctors, for nurses, for basic BLS nurses and other healthcare people will also can access it. Even anybody can access it. Then ACLS, Advanced Cardiovascular Life Support, is for doctors and some cadre of a health officer. Then Pediatric Advanced Life Support, that one is for doctors. Advanced Trauma Life Support, that one is also for doctors. So my experience actually, what actually stops these people from getting this training is rarely do institutions say, okay, we're paying for our staff to have these certifications. You get your salary, then you pay for it and all the rest and get the certification. So not a lot of people that have family issues and things, the salary is not even enough, then people, get off X amount of money to do this. Though at the long run, it's actually very useful to you because it is capacity building, and if you want to go to any other place, but the immediate thing you have to solve is waiting for you. So if only the government would have a system whereby these trainings can be subsidized or paid for. But let's say we say hospital, for example, you bring out, say, if there are, example, 100 nurses in Wise Hospital. If you select a list of 20 to ensure that they are certified that they have the training, it will be wonderful. In every hospital, say Wise, Metama, blah, 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 20 people from each. If there's no fund for all the nurses, just select 20 from all to ensure that these people are certified and they have this. Among the doctors, select 10, or I don't know the figures, but just few, and ensure that they do this certification and all the rest. In next year, some other group of people can also do that capacity building and enhancing, improving the system where you're operating.
So if we're able to put these things in place and we have infrastructure now, that will be the ambulances, will that give us a semblance of what we see in the US, like with the 911, as fast, as quick, and as effective?
Well, it will somehow give us a semblance of what we have. And beginning of the program, I give you an instance. A quasi emergency ambulance service that I offered as an undergraduate, and that's a young girl's life was saved. So it will, to some extent, give us a semblance of that. But the system we are working in. If you talk of time of ETA, especially time of arrival for an ambulance, a lot of factors affect it here. We are not currently. We had a meeting sometime with some people in the FCT, and they were like, "Why are you not in Lagos?" And the answer was, "Look, this is if you're an ambulance service company, and someone calls you, he's subscribed and he calls, and you don't come when you should come. It's not just about the profit or the money you're making. It's about the service you're delivering. It's a life and death situation.
Yes.
So if you do not arrive when you're supposed to arrive and something happens, you bear liabilities. You understand? Somehow in the country here, people do not really sue. But outside the country, you get sued. We have, British people who actually work with us. And we try to do things. But what I'm saying is that if you want to work on this and you want it to actually work, a lot of factors comes in also. If you want to have the same thing you have outside the country, our roads, how excellent is it?
Okay.
You call me now in Maraba, and that traffic from here to Yanya will catch me up. The ambulance will not fly.
Yeah.
Do you understand? Number two, like we talked about the personnel. Do you understand? The people's attitude also really will also. In Germany, there is a specific lane that is left for ambulances.
Emergencies.
Just ambulance, not even a governor or somebody will be running and enter that place. No, it is for life-saving situations. Even if traffic is here, like that place will be empty. Yes, but if an ambulance personnel runs into that, say Kubwa, from here to Kubwa, or from here, those places where you have gridlocks, no matter how loud your siren is,
Nothing changes.
a lot. In short, they will listen to and make way for a military man or a politician who is actually making noise and passing than an ambulance who is carrying a pregnant woman that is, you understand? So the people have to also accept this as ours and know that it could actually be you that is in that ambulance. It could actually be your wife. It could actually be your child. So once you hear an ambulance, a siren moving, I mean, people should give way to that. So, and that's how it's done abroad. So these are factors that would actually make us to
have a semblance of what we would actually want. Now, there was something you said about suing people, and for you as a businessman, because emergencies is business for you, even though it's life-saving. But one of the things is how you're able to make your profit. But that would be when we come back from this short break. I want us to take a break. And when we come back, we'll discuss how emergency service providers, how they're able to make in quotes, their profits and how they're able to even survive in this situation, most especially, like we say, the Nigerian situation. But that will be after this short break. So do stay with us. When we come back, our discussion will continue.
Following the sudden outbreak of cholera in some parts of the Federal Capital Territory, significant number of cases have been tested positive for cholera. The Health and Human Services Secretariat has intensified surveillance in the affected communities around the area council. Therefore, residents are requested to report any case of diarrhea to the nearest health facility or the Department of Public Health on the following numbers: Dr. Sadiq Abdurrahman, 0803-705-1784, or Dr. Doris John, 0803-315-6560. Ensure that the water used for domestic purpose is clean, boiled and filtered. Start ORS immediately you have diarrhea. Ensure that all food is properly cleaned and well cooked before consumption. Ensure that fecal waste are hygienically disposed of. Do not defecate in the open or into streams. Houses with surface wells should make sure they are covered all the time. Public Health Department, FCT Health and Human Services Secretariat. Announcer.
Welcome back, and thank you for staying with us. If you're just joining us, this is Health and Wellbeing on ASO Television. And before we went on the break, we've been here with Mr. Christian Obodozie Uche, who is the CEO and Country Director of AfriEmergencies. So before we went on the break, I told you we're going to discuss how emergency service providers survive. The reason I'm asking this is because we know that emergency services are not necessarily included into the National Health Insurance Scheme, which would have made it a lot easier for people to be able to access emergency services. And so paying out of pocket, which is one of the major issues now we have with the healthcare system, is a major problem for all of us as Nigerians. You know, how much will I subscribe to an emergency service provider for when I would be in need for emergencies and all of that. But for you as a businessman that owns an emergency service organization, how are you able to stay afloat with the so many challenges that are posed to you in the country?
Well, again, I refer to the beginning of our program, actually. You need to have a passion for something to actually move it through. That experience I had as a young chap, actually made me understand that, I mean, people are dying, you understand? And when you have a passion for life first, I mean, service is improved, and then the money is also very important. But if, I mean, the system starts functioning very well, people are, I mean, are saved, it gives you joy. So how are we able to stay afloat? Rightly, You see, hospitals, like you said, a lot of hospitals do have ambulances. A doctor once told me, look, why are we even buying an ambulance? Why do I need an ambulance in my system? The ambulance I have here is just lying down. It is lying fellow. It's not being used. Do you understand? And I bought it for, they say, for 6.something million naira, and that money could have been used for some other things. You understand? Yes, it makes people know that your hospital is big and all that, but what is that ambulance generating to the hospital? It's not really generating anything. And that is the problem he has. So that problem he has, a lot of hospitals also have this problem. I mean, buying an ambulance. The only consistent use of ambulance, which we all accept in the country, is for carrying corpse. You understand? In short, a lot of people still think that ambulance, that is what it does. You understand? And it's not even an essential part of pre-hospital of an ambulance service. You understand? So we have actually tried to carry these hospitals along, bring them into our system to ensure that instead of their ambulances lying dormant and then maybe some selling some off, to ensure that their ambulances become profitable, can generate money for the hospital. Do you understand? Because for us, we cannot actually have all ambulances needed to service everybody. So such partnership actually, it becomes a win-win situation where they can actually make money from the ambulances. The ambulances offers enough services. They have enough people to service. You understand? And we also, on our own part, get some distance from that. Then coming to NHIS, yes, emergency ambulance service is not included in the NHIS. It's expected that where your care provider is, they will actually offer you that. But I think that was actually a very wrong. Well, it was an over. How do I put it?
It was overlooked.
It was overlooked because pre-hospital care, emergency ambulance service is a vital factor in the entire system of healthcare provision. You understand? And it's a missing link that is consistently missing in our healthcare architecture now. You imagine the hospital you use for HMO is your care provider is, say, let's call you, say, DIF or this, top premier hospitals, and you're using such a first-class hospital, and then you now have an issue and the hospital is situated in Asokoro, and then you have an accident or something in Kubwa. How are you going to move from Kubwa to Asokoro to present yourself? Imagine your hospital is in Karu, and you have an emergency issue in Gwagwalada. How are you going to move from there? Because you're expected to go to the hospital to access care. How are you going to move from Gwagwalada to Karu to access that care? And you're now left to the care of bystanders. People rush around and carry you and throw you into the back of the car. So it's actually a missing link that was left out. But kudos to some, again, I'll say people like FCT. I think they are working on a way of mitigating that very problem. Do you understand? And I hope other states will also, follow suit. Do you understand? Because amending the NHIS Act will be an act, and a big thing in itself. And also some HMOs have also, they find a way to actually fill in that gap, and we are pushing it. And God willing, like I said, that this system that the Ministry of Health and the FCT Health Secretariat is putting up will actually, to a large extent, take care of this problem. So, to your question, how are we making? We are moving up, doing it, we're offering care, and by God's grace, we are still here.
So if there is, left you as someone that is practicing and is in the field, if there is one thing that should be given priority that would actually help in fixing the architecture, most especially as it relates to emergency services and in relation to NHIS, I know you gave examples of, okay, if your care provider is somewhere in town and you're in a suburb, yes, how do you access this? It is a major issue. So what are the things that can be done to see that this is fixed? If eventually emergency services are included into the National Health Insurance Scheme. How can we now fix these issues that are going to pose as loopholes in making sure that it's effective?
Well, if whether or not well, we can't wait until National Assembly and these people include. I mean, it is emergency care is something of now. As I speak with you now, people need emergency ambulance services.
Sure.
You understand? It's now thing. It's not so. For the now, I think improvement in infrastructure is actually a very vital thing. And what are these infrastructure? You have the consumables, you have the basic, which is the ambulance itself. You understand? But the fact is that I am not a proponent of the government buying ambulances and spreading everywhere. We've done it before, people have done it, and it doesn't work. I can mention like 5 states that have done something like that, and I mean today, some of them are packed and it's not functional. You understand? There should be a system there that should encourage the ambulance service companies and hospitals to actually increase their assets of ambulances. Do you understand? Currently, we're working with a particular car assembly company to ensure that that is done. I mean, hospitals that we are working with can have access to these ambulances and pay, I mean, at a pre-agreed distance. By so doing, if government encourages this type of system, you see that there will be a lot of ambulances in the system offering services to the people. The government serves as a regulator, do you understand? And, I mean, the government, with its low cash availability, because government is always saying there's no money. Now, there is no need of buying ambulances and throwing it into the system. You put ambulance in the system, you have to recruit people who are managing it, you have to ensure servicing of the ambulances and buying of tires and all the rest. Now, let the hospitals, let the ambulance service providers take care of this. Do you understand? Push it out to them and ensure that, I mean, you give, there's a language that the president used in budget presentation sometimes, say the enablement. The government, the function of the government is to ensure enablement. That was the first time I actually learned that word. When you put an enablement for such a system to run, it will run seamlessly, and there will be, I mean, a lot of ambulances and infrastructure, both consumables and non-consumables in the system. And then people would have confidence that this system is available, it is functional, and we can access it. Because now, if you tell people, we actually have that problem. Even when you talk to people who you think are very well educated, you know, they say, this is no go. It will not work in our country. It will not. Yes, and people are so lethargic to it that it will not work. Or it is not. But yet, people are dying. Yet, a pregnant woman, I mean, has preeclampsia. He needs immediate care. You carry the person and through at the back of the car and start running to a hospital. Someone has cardiac arrest, and you drag the person, carry him, and put him at the... I was in Asogoro Hospital some time ago, and they brought in a man. The man suffered a massive cardiac arrest, and they rushed him. But if you see the situation, how he was at the back of the seat, even if you are rich, you say you are very rich, you're living in Maitama Asogoro and all the rest, and you suffer a cardiac arrest or something, serious emergency situation, at night. The only thing that, as I speak to you today, except you have a pre-arrangement, what you would do is to enter into that your S-Class or whatever Jeep you have, carry the person into that Jeep, just you, your wife, or whoever, no medical person, and start running to hospital.
the hospital.
Do you understand? It has happened. I'll give you instances of some top people in the country who had such issues. I can call names. You understand? Our former Senate President, Chuwa Kadibu. You understand?
Before we don't call names.
No. Okay, without names. Even in the country and out of the country, there are, especially in our country, there are a lot of big people. So it's not a thing of big man or no big man.
Yeah.
Everybody needs this, and it's very vital. It is vital.
True.
Yeah.
Well, just like you said, our health is our wealth, and when it comes to health, there is no big man and there is no small man. And there's a saying that says the poorest man is the only man, the man that thinks that he has money, because money can definitely buy you everything.
Of course.
There are certain things that have to be put in place to actually make life better for us. Well, Mr. Chris Chen, thank you very much for taking out time to be here with us. On health and well-being, we sincerely appreciate your presence.
Thank you so much.
Well, that's how far we can go on the program. I do remember that our health is our wealth and we need to take care of ourselves. We don't necessarily have to wait for the government to put things in order for us, but just a change of mindset will go a long way in making sure that healthcare system, even in Nigeria, becomes better. Well, that's the size of our package. Do keep it a date with us same time next week. I am Lois. Appa Sambo. Do stay safe.